Welcome to True Health Tuesday, and the truth will set you free. Okay, today we're talking about stenosis. Cool thing is, I met a guy a couple of days ago, and we were going through what stenosis is. And does that have a neurologic component, and what happens? So this is going to be really exciting. The second part, the censored part that is not going to get by the censors or the Ministry of Truth, we're going to get into the science of science. Okay, now all of this stuff, all our deleted videos, we have about 85 of them now that have been deleted. A lot of them, about 70 of them, we took down because they gave us a strike and we couldn't post stuff. So we're trying to get along. Even though some of these videos have been up about 4 or 5 years, go to the Dr. B VIP. If you're already on the Dr. B VIP, thank you for your support. And if you're not, man, click this, like this, and share this. Because one of the comments I got yesterday was, oh my God, I didn't know we're still putting these out. We put them out every week, okay? But we're shadow banned, demonetized, and deleted. So get on there. We're going to take over the censorship. We're going to take back, and we're actually looking for a new server that we can put this stuff on. But get on Rumble too. Rumble is bitching. Okay, that is really, really a cool site. But just to see videos with free speech and not have a warning underneath that this is missed information. Extreme Health Academy, amazing. Okay, get on there if you have any health issues or just want to maximize your health, because you're going to see people that have gone through this. And I'm on there at least once a month doing a webinar. FDR. Okay, now imagine this, 1941. It said there's 4 essential freedoms. And just, I know this was a different time, but just think about it. Freedom of speech and expression. So I disagree with what you're going to say, but I'll defend to my death your right to say it. Remember that? Yeah, that was cool. Okay, the second freedom is everyone to worship God in their own way. That means that you could worship it with or without a face covering, if you want to. Okay, that the churches shouldn't close. Okay, it's up to you. Third is freedom from want, which I think is brilliant. Okay, but to secure a nation, to make sure that you have independence, I mean, that's amazing. But also, we need to have the opportunities. The fourth freedom is free from fear. And this is hugely important. Now, this was American and at a different time. So what is stenosis? Yeah, that's like a mic drop. Say, oh my God, we don't have any of those 4 freedoms. Okay, stenosis. You're looking at infecting 250 to 500,000 people, and it's more than that because you're going to look at a lot of this stuff as asymptomatic. But stenosis just means narrowing, okay, narrowing of the canal. And when we're looking at this is an actual plastic model of a human spine. Now, the head should be over the pelvis. We should have a 45, 36, 32 degree curve here. And the joints are laid out at 30 degrees here, 60 degrees here, 90 degrees here. So it's actually a beautiful structure. Now, the problem is if you have any structural abnormalities, like forward head carriage or lateral deviation, that causes stenosis. It literally causes narrowing of that canal. That's one. Occurs in the neck and low back, obviously, and spinal cord nerves. Now, when we look at this, lumbar stenosis, okay, and this is in the low back, how many people sit down during the day? I know everybody here. Okay, sitting increases the pressure 5 times normal, okay, at the L5-S1 disc. Now, you might think, wow, that's a lot. Yeah, except when you sit on the ischial tube here, and that flattens out and opens up the holes where the nerves come out. So even though the pressure is building up, you don't feel it. Now, golf, when you're bending forward, twisting and turning, that increases the pressure 8 times normal. So if you were golfing for 4 hours a day and said, man, my back's sore, that makes sense. Sitting for 4 or 5 hours a day and say my back's sore, that doesn't make sense. So we're going to show you how to turn sitting into therapy. Lateral recess stenosis is the pain generator for 60% of the patients with failed back surgery symptoms. Failed back surgery syndrome. We're going to get into that as well. Okay, so now symptoms of stenosis, it's nerve pain. Now, all the nerves exit the spine. Now, only 10% of those have pain fibers. And this is why when somebody's asking, does that pain radiate to the knee or beyond the knee? That's a ridiculous question because you're asking the person to come up with only 10% of their nervous system instead of asking about their physiology. Muscle weakness, abdominal walking, cramping, impaired bladder control. They should have bunion formation. Now, the medical view, this is the medical view. Age-related, we're going to blow that out of the water. Affects people over 60. I am, okay, over 60. Spinal stenosis occurs when something reduces the amount of space. Okay, now they're talking about an overgrowth of bone. Yeah, your body's just stupid, it grows bone. No, we're going to solve that. Herniated discs, can you regenerate them? Thickening ligaments. Why are the ligaments thickening? Okay, spinal injuries. So instead of, and this is what we're doing now, I've got a doctor here. Well, we've got doctors all the time coming from different parts of the world with the kibosh and a lot of the travel. We've got one doc from Thailand. And in a lot of doctors, they don't learn critical thinking. It's always, what do you do for type 2 diabetes? Well, metformin, glucophage. Okay, well, what causes type 2 diabetes? And you get this blank stare. So the why behind it, that critical thinking of why, and that's what we have to open up. Why would a disc herniate? What causes it? What causes ligaments to get thickened? And so to just say, well, we'd give this therapy or this therapy, that's not, you're just regurgitating what your instructors told you. Now, degenerative disc disease, degenerative joint disease, osteoarthritis, those are the same three things. None of those are true. For one, it's not a disease. It's not degenerative. It's only from trauma. And this is out of Kirkcaldy and Willis, which is like the Bible for physiotherapists. Okay, it's one of the books that we used when I was teaching. And so it's not age-related. And so what they did is they took bones out of elderly cadavers, bones out of young cadavers, put them through compression, torsion, all these different tests. They found out old bones are just as strong. I guarantee you they're just as strong. Okay, so it appears that all this degenerative disc disease, degenerative joint disease, it's not a disease, it's not degenerative, it's adaptive from stress. So when they say old age, hell no, tell that to the 90-year-old. Oh, heck no. I've got patients in Illinois. God bless you, brother, and I'm gonna watch my language. He wants his kids to watch this, and it's my fault. Okay, I'm gonna clean it up. Okay, so age has nothing to do with it. The weird thing is we're designed to go to 120 minimum. Okay, so when somebody, dies at 80 or 90, I don't want you to say, wow, good full life. I want you to say, oh my goodness, they had 40, 50 years left. Okay, that's a crime. What happened? Were they hit by a bus? Okay, so normal. The aging that we have is insane because people are not supposed to have wheelchairs. Okay, but if you deal with their body with chemicals instead of how it regenerates. Now, grades of arthritis, it's basically grade 1 means it's not in the right position in motion. And there's some alterations in movement, but there's no destruction of the disc or bone. Grade 2, we're starting to see the disc get smaller and closer. And grade 3, we're seeing a lot of bony distortion. So let's look at that. So you've got a disc, okay, that separates the two bones. Now, discs have a horrible blood supply. Like if you were to take this body, okay, let's say this is my body, and you cut from here up off, you're looking at probably 100 and something pounds of human over the size of a 50-cent piece. Okay, because that's the only structure holding you up. So blood vessels to that area would be compromised. Okay, and so what happens is the discs get their nutrients through movement. So here's the challenge. Bam, you get a trauma. That's a reverse curve in the neck. So you're talking, instead of a normal curve, you get that forward head carriage. Now, is the body smart or smart? Yeah, I'm going to give you one choice. It makes it real easy. So that means for every 1 inch the head's forward, the pressure on the disc doubles. So that's going to fire off these muscles in the back to reposition it. Now, how do people treat tight muscles? Relax it. Okay, that's crazy. You got to find out why they're firing. Now, if those nerves are compromised, which they are, the muscles are going to lock in to limit that motion. This is why after a trauma, I'm stiff, sore, tight. Yeah, because those nerves are trying to protect the 90% of the nerves that you have no pain fibers. Now, if those nerves or those that trigger the muscles to fire off limit the motion to that joint, guess what? It gets compressed. If that joint gets compressed, it becomes unstable. So the body is going to start to change the shape of the bone in order to stabilize that joint. So you look at normal, you look at damage, and let me tell you, you can take a probe, which kind of looks like a pen. Okay, and I taught human dissection on and off for about 8 years. You could pass it through the bone pretty easy. You can't beat it into a disc with a hammer. Okay, the disc is 80 interconnecting rings of ligamentous tissue. So discs to herniate doesn't happen. I mean, rare occasions. Okay, if you're hit with, I don't know, a few tons of steel. But I really think it bounced off of you. So you get a man of aluminum versus a big no. No, so when you look at this, trauma, okay, causes that limited motion. The limited motion causes limited nutrients. Then the bone distorts to stabilize it. This process can be reversed, where you create inflammation at the disc, then the disc regenerates, then through Wolff's law, bones lay down where it's needed to resorb where it's not. The bone spurs actually start to eliminate. You can actually see those on post x-rays. So when you look at this slip, bulging, herniated, okay, they're not really accurate because you are never, ever going to find a perfectly shaped spine everywhere and have one disc that's the problem. Ever. And so if you've gone to the doctor and say, yeah, man, oh, is that pain radiating to the leg or beyond the leg? Okay, that's ridiculous. Because this alteration will affect your entire physiology. So the doctor should be asking, how are your bowel movements? How's your sleep patterns been? Okay, how's your body adapting to this? So when you get that response that you do have a herniated disc, back pain, and you're suspecting stenosis, you got to look at the entire structure. Because if this is hurting here, guess what? Your body's going to lean away and open it up. So when you look at the posture, if the person's, and do this right now, like if you don't have any back pain, sit up nice and straight. Okay, slide your body off to the side. Okay, now my shoulders are level. Where do you feel it? Ow. Yeah. Okay. So could that be my body leaning off to the side because I got to open this area up because I had a thoracic injury? Could it be that I twisted my right ankle and I've got to shift off to the side? Could it be that I'm trying to open up the nerves on my neck? So just because you got a symptom here doesn't mean the problem's there. That's insane. Now, this one's still up on YouTube, but this is my daughter-in-law, and it was about 4 years ago, where had a corrective disc injury. And it seems, I mean, this is basic common sense. You have a trauma, and the joint gets compressed. So would you like to decompress it? Am I going too fast here? Okay, no. If the body is knocked off to the side, and this is her x-ray over there, should you distract it, open it up, and move it over? Gosh, that makes sense, doesn't it? I know what you're thinking. Since the body is like this, maybe we should just shoot it with cortisone or ultrasound it or operate it on it, not look for anything else. No, that's ridiculous. Okay, now, MRIs are completely inaccurate. For one, inflammation distorts it, but body position distorts it. So again, we've got the normal shaped spine here. Now, how are MRIs done? They're laying down. So when you're laying down, gravity is pushing down, and the head here is pushing up. The thoracic is pushing up. The pelvis is pushing up. So this is completely distorting the image. So it's not a normal position. So when people say, well, I have a disc bulge, I had it 10 years ago, and I saw it on MRI, That's ridiculous. I mean, you wouldn't say, oh, I cut my hand 10 years ago. Well, did it heal? You know, broken tissue heals. Discs are alive. So here, Stephen Brownstein talks about the difference between an MRI in the supine position and standing. A world of difference. Okay, then you've got the surgical interventions. Surgery fails so often that they called it a syndrome. Anytime somebody uses the term syndrome, run, because they don't know what the heck is going on. But chronic low back pain, failed back surgery syndrome, it's actually a billing code because they fail so much. By far, the number one reason back surgeries are not effective and some patients experience continuing pain after surgery is because the lesion that was operated on is not, in fact, the cause of the patient's pain. And when you look at this, you're looking at a lateral deviation in the low back, you're looking at a thoracic deviation, the body's over here. You got to look at the same body. You got to look at the entire structure. Because if you have, 80 pounds of human laterally deviated, you're going to feel it here. But the problem may be somewhere else. MRIs are completely inaccurate because you're laying down. It'll show you a really pretty picture. Okay, but that's the computer interpretation of what's going on. Inflammation distorts the image. That's why I really like lateral bending films, static and stress x-rays. But here you go. We're looking at before and after. You can see a larger deviation and less of a deviation later. See, with only 10% of the nerves carrying pain fibers, if you're not doing a second x-ray or a second test, whatever test you did to identify the problem in the first place, by gosh, do it again. Okay, and this is chiropractic 101. Find the problem, fix it, and do your post-test to make sure that you did fix it. Because you're talking only 10% of nerves or symptoms. Now, 18 degrees down to 8 degrees, that's nice. But here's the worst part. Chronic pain. And this is pain from not just stenosis and the disc injuries. It literally changes the shape of your brain. And I met a guy a few days ago who inspired this talk, and he's asking me about, because I could see that there's a little bit of a shake. And I said, that tremor, how long has that been there? Well, I had surgery for the stenosis in my back, and, now, because when you alter the communication of the brain to the body, the brain's going to start to send motor impulses down to get the brain to function correctly. But pain of 6 months duration can cause mental declines, brain fog, cognitive declines. It literally starts to shrink the brain. When you alter the communication like this, and these are steel rods, to put the steel rods in, you've got to remove some of the vertebrae. They literally, these parts sticking out are called spinous processes. So they go in and they cut the lamina that holds it. So that destabilizes it. Then they put steel rods bolted to the spine. Now it's needed in some traumas, not needed in a lot, okay, because we see a lot of damages after that. And you're going to see the statistics are horrible for it. But this is altering the input into the brain. So if you have had that surgery and noticed like a little tremor, yeah, that's your body adapting. But here we go. You can see that his entire torso is shifted off to the side. Is that going to cause some disc injuries in the low back? Well, absolutely, it's going to cause an abnormal force loading. So when we're looking at brain function, the brain, the entire brain, gets its information from the mechanoreceptors. And there's 3 different types. Okay, the joint mechanoreceptors are the facets. You've got muscle spindles in the intrinsic muscles, which literally 4 times the muscle spindle receptors than in regular skeletal muscles. And even the ligaments have sensory component. So if you alter that, you fuse that, you change that input, you're changing the input from the body to the brain. I mean, hugely important, hugely important. And what's the frontal lobe? The frontal lobe, see, all this information communicates to the small brain in the back called the cerebellum. And the frontal lobe is anxiety, stress, depression, impulse control. And this is Parkinson's, addictions, obsessive compulsive disorder, Tourette's, depression. I mean, it's everything. So when somebody has that, you're looking at a frontal lobe dysfunction. That frontal lobe is programmed by the spine. So when you say that you've got spinal stenosis, hey, you've got altered brain function. Okay, you've got altered physiologic functions. You've got altered autonomic function. And that's huge. So you cannot just address the pain with a shot, a drug, or a surgery. That doesn't make sense. You've got to look at the physiology. Because if I'm standing on your foot, your heart rate's going to go up. Blood supply to the gut's going to shut down. Liver's going to start breaking glycogen down to glucose. And if you have that spinal stenosis and it's always irritating you, guess what happens? Your body starts to distort. And eventually you come to a chiropractor and they take a posture picture and you say, my God, that's me. Yeah, there's a problem there. And again, when you look at this, none of these diagnoses are a diagnosis. Wait, that doesn't make sense, does it? Okay, when we look at high blood pressure, what's broken in the body that needs to be fixed? Or is the body adapting to stress? Type 2 diabetes. Is the body adapting to stress, or this a disease? What does type 2 diabetes look like outside of the body? What color is it? How much does it weigh? Or is this really an adaptive stress response? Anxiety, fatigue, sleep problems, low thyroid. Low thyroid, does that mean that there's maybe an inflammatory response? None of these are diseases. They're all adaptations. Now, what chiropractors look for is the subluxation. Only 86% of the schools are not teaching this anymore. Okay, but a subluxation interferes. Now, think of this. The brain is going to respond to the environment based on information coming up. You've got your entire digestive tract run by the vagus nerve. And this vagus nerve does all the peristalsis, the excretions, the everything in there. And that's everything. That's how your body is alive. You're able to take whatever you put in the system and break it down to protein, fats, and carbohydrates. That's only 10% of the vagus nerve function. And it does it all. 90% is sensory going up to the brain. Because the brain's got to know what you're putting in the system, how you're adapting, how you're thriving in this world so you can thrive. And that means all of these sensory inputs has to go into the brain. So if you have something that's misaligned from a trauma, accident, whatever, from its juxtaposition of the vertebrae above and below, it alters the system's ability to regulate, to heal, to repair. Oh my gosh, that just makes so much sense. Now, it's not a thing of elderly. Here's a 2.5-year-old with a reverse curve in their neck. Now, did they have ear infections? Okay. Did they get chemically assaulted with certain things? Okay. It's crazy. But we have to look at this. Now, surgery. Over 500,000 people get it every year. It has a 75 to 80% failure rate. This is fact. This is the Mayo Clinic. Now, Mayo Clinic says some people's symptoms stay the same or get worse after surgery. Surgical risks include infection, tear to membrane that covers the spinal cord, blood clot, leg vein, and neurologic degeneration. Return to work rate is 15%. So does that mean that if you have a trauma and you're in a workman's compensation case that can only look at the area of pain and you're not looking at the rest of the body, and they inject, operate, or shoot this thing, that they have a great failure rate? Yes or yes? Okay, because you're not looking at the whole thing. I love this book, Surgery, The Ultimate Placebo. Oh my gosh, by Ian Harris. There is very little evidence that spinal fusion for surgery of back pain is effective. It's very expensive, leads to complications. Okay, and I mean, it's crazy. Let's look at the journal, the Spine Journal, okay, 2008. Although there are multiple surgical options for treatment of chronic low back pain, there's currently insufficient evidence on which to draw any firm conclusions as to the effectiveness of the clinical outcomes. Lumbar fusion for any common degenerative changes appears to offer limited relative benefits, if any, over intensive non-operative management. Isn't that interesting? Steroid injections. Okay, and again, I hate to hit people with common sense, but we had a structural deviation here. By injecting this area that the person hurts, is that going to straighten up the body? Okay, but it does damage the tissue. Okay, so it damages the cartilage, bone, the structures. Before they started to put limits, I think there's a limit of 3 shots they can do per area now. This one gal I was working on, and this was in the late 90s, 22 shots of cortisone in her wrist, elbow, and shoulder. Then the wrist hurt, then the elbow hurt, then this, and that. I mean, it mind-blowing. Muscle relaxants. Muscle relaxants are central nervous system toxins that attack the base of the brain. Studies don't provide evidence for long-term use of muscle relaxants. Central nervous system negative side effects, transcutaneous and nerve stimulus. This is the TENS units. Although electrotherapeutic modalities and physical agents are frequently used in the management of chronic low back pain, few studies found their support. Wait a second, so drugs, muscle relaxants, TENS unit, interferential current doesn't work, muscle stim doesn't work, ultrasound doesn't work, hot pack, cold pack. No, I use a cold pack. It felt good. Yeah, but it's not fixing the problem. Okay. So what about non-steroidal anti-inflammatories? I get people in and I'll say, what kind of medications are you taking? Oh, none. No, I mean the hardcore stuff like Advil, Motrin, Aleve. Okay, and then they'll go, really? Those are drugs? Yeah, 20% of all heart attacks, congestive heart failures, hearing loss, GI bleeding, 7,000 hospitalizations. But wait, what does it do? Inflammation is how the body heals. So these chemicals alter the body's ability to heal. So it's destroying joint cartilage, just like the cortisone shots. Mind-boggling. So here it is. The official causes of this, remember, arthritis, herniated disc, ligaments, and spinal injuries. I got an idea. Here's the solution. Reverse the arthritis. How do you do that? You create an inflammatory response, okay, at the level of the affected disc so it can regenerate. You apply a force loading in the direction that it should be. But before you do that, you take a stress x-ray in order to see if you can move it. I know right now you're saying, oh my God, it's too much common sense. Geez, where's the drug commercial? Okay, what am I supposed to think? Okay, so yeah, reverse the arthritis. Okay, herniated discs. Discs are alive. And I had 2 orthopedic surgeons and they looked at me and they said, discs are alive. I said, yes, they are. And I had to walk them through it. Okay, just think about this. Do you have living tissue in your body or dead tissue? No, you got to walk them through it, okay? I mean, you could walk them through the weird way, where people that know, that don't really know, okay? And so you use 2 things, obviously and as you know. So, doctor, as you know, there's dead tissue in the body. It's eliminated by the body through macrophages and everything else. So obviously, it's living tissue. So as you know, doc, discs get their nutrients through movement. So obviously, if there's loss of nutrients to that disc, then it's going to get compressed. So as you know, if we restore motion and position, then the disc can start to imbibe and fill up. Okay, so you walk them through, slow. Okay. Thickening of the ligaments. Why would ligaments thicken? Well, for one, if you have a normal force loading, the ligaments are going to be normal. If you have an alteration, you're talking stretching these ligaments and compressing these ligaments. So the ligaments are going to take up a whole different force loading. So let's say you have forward head carriage. Let's say you have loss of curve. Let's say you have a lumbar herniated disc. Okay. Yeah, I see this. In fact, I saw a lumbar or disc herniation or lumbar whiplash today. And that will stretch and strain and distort the ligaments, causing the ligaments to work beyond their physiological motion, what they're designed, okay, they're force loading, and that's going to thicken up the ligaments. So how do you correct that? You put it back. You correct the biomechanical problem. I know. Spinal injuries. Identify and correct the damage. And you might say, no, this is too complicated. Okay, let's look at some cases. Here you go. Upper neck pain, 6 months. Okay, and then also low back pain, headaches, digestive problems. What do you think digestive problems since he's been hurting for so long? Okay, do you think it's constipation, reflux, bloating? Absolutely, yes or yes. So now here's 18 degrees. Now you got to watch it really fast because I'm gonna go back to 11 degrees. 18 to 11, 18 to 11, 18 to 11. And I know this is going to drive you crazy, John, because you got to go back and forth. Okay, but isn't that cool? I call it the movie version because you could really see the change in biomechanics. Okay, now here you go. Loss of curve, 100% loss of curve in the neck. Okay, how do you identify if you can fix it? You bend it. Oh my God, that's mind-bogglingly simple. If the joints work, you can restore the curve. And this is the minimum amount of correction. Let's say you have somebody with, let's see, 2 discs, a laminectomy, fake disc, and 3 surgeries. And yes, they still hurt. Okay, so what do? You take this spine and bend it to one side. The disc should be narrow on the concave portion, wide on the convex. If any of those discs are altered, where they're wide, where they should be narrow, that's abnormal dysfunction. And you could call it slip bulging or herniated, but those are foolish names. Okay, it's an adaptation to stress. Okay, this isn't a label like harlot or something, you know? So you have to look for those adaptations. So when you bend to one side, then you bend to the other side, then you have a good idea of disc motion. But the ultimate is the muscles on either side of the spine, they're not even under conscious control. So when we lay someone down and traction or bend or turn, because when you bend the body to one side, the muscles on the convexity should be increasing in tone because they're trying to tighten it up. The muscles on the concavity should be relaxed. And what we'll see here is an alterations in proprioception, where sometimes the muscles here will be tight, sometimes here it'll be. So the whole adjustment is designed to change the brain's awareness of the body in space. Let's look at this guy. We've got 3 abnormal discs on one side, 2 abnormal discs on the other. Okay, and it just makes sense to identify it while they're weight bearing, while they're bending off to the side. Now, when you're looking at the post x-rays or stress x-rays on the neck, the hard palate is the key. Now, that hard palate can change about 10 to 15 degrees up or down without affecting the neck. If it goes 20 degrees, bam, you got to reshoot the film. Now, here's a patient. God, I mean, I love the scale. But you'll see the first surgery was on the left. Now, we're looking at multiple areas where and this wasn't a trauma. She was able to carry a bag of concrete across her yard before she had the surgery. After the surgery, horrible. And then she started to notice the shaking because you're limiting information up. So I sent her back to the surgeon, and I said, because it went all the way up in the neck. And there wasn't any pathology in the neck. There was good disc space. There was no reason to have it. Okay, and also too in the lumbar, there was no damage to the disc. You could still see the discs were fine. So we said, okay, so we took out all of those bolts and put new ones in. And you have to put new ones in because they had to remove some of the parts of the bones. I mean, horrific. This is her before and after neck. And I'm going, there's no reason to put those bolts in there. The discs are fine. But the trauma is horrific. Here's one. Fake disc and a plate in a person's neck. Now, every time they swallowed, they could feel the plate. Okay? But we were able to, get the curve back. But again, when you have a problem in the neck, when you have the problem in the neck, all the muscles that support the neck come off of the head and attach up here in the top of the thoracic area. So if this baby is forward, do you think you need to look at anything else? Yes or yes? I mean, it's just common sense. So when you have somebody like this, again, we're looking at significant trauma. Okay, now this is causing stenosis. It's causing degeneration. It's causing damage. It's causing muscle spasm. Fix the cause. Fix the cause before and after. And it seems just incredible. I mean, we had a 19 degree bend down to 12 degree. Now this guy's got a 42 millimeter short leg. Okay, so there's going to be a bend there. But if you reduce it from 19 to 12, that's less stress on the joints. He's going to have a short leg. He's had a short leg for his whole world. But does that mean he has to have the back pain and knee pain? No. Does that mean he needs an 1.5 inch lift? No. He's adapted to this. So you change the force loading. Now, this is some of the exercises we give. One of them is a foam block because we got to turn sitting into therapy. Now, where does this go? The bottom of the elbow is the bottom of the block, and it goes right here at the thoracolumbar junction. Why? Because it's pushing in here. Now, what would that do? That would create a negative pressure, forcing this open. Okay, a negative pressure means it's forcing that disc material from the back to the front. Now, you want to keep it in there for 20 minutes, take it out for 10 minutes. I definitely wait till you get an assessment by a corrective chiropractor. Because if that baby hurts after 5 minutes, or it hurts immediately on putting it there, it might be in the wrong spot, or there might be some kind of pathology. So you can't do these exercises until you find out what the heck the problem is. And made this simple thing to help the curve in the neck. This is literally pipe insulation with webbing that we used to use for climbing. Okay. And I got it really fancy. I had somebody, this is as simple as you can get. You pull down with about 2 pounds of pressure, and then you look up and then look straight ahead and relax. So this is a simple way to imbibe the discs. But find a corrective chiropractor and identify if you can use that. When we look at trochanter supports, the pelvis, and this shows what a nasty instructor I was, name the muscle that crosses the posterior aspect of this. There isn't one. Okay, and you had to write that in. Yeah. Yeah, instructor from hell. Okay, so, but when you look at this, piriformis goes on the front. You've got the hip flexors going on the front. So if you've got any of those chronic piriformis syndrome, any of that, none of those are issues, because muscles don't just spasm on their own. There's a reason for it. So we give the trochanter support to stabilize that pelvis, because the pelvis is, if there is a pelvic issue, either you've had a significant trauma or there's a disc injury secondary to the pelvis. Then pain relievers. What's the best one? Man, omega-3s, fantastic. Vitamin C is excellent. Indian frankincense, curcumin, cayenne cream. Cayenne cream, be careful, because if you have an open wound, you'll find it. Yeah, lemon and salt is worse than is not as bad as the cayenne cream. Devil's claw, excellent, because now none of these stop the inflammatory process. But inflammation creates free radicals, and that free radical can damage healthy tissue. So this deactivates those free radicals. Vitamin D, fantastic for tissue healing. Astaxanthin, ginger, bromelain, fresh pineapple. Just incredible. So now this is what you do to find a corrective chiropractor, and this is hard. It's like finding hen's teeth, okay? Do you take x-rays? Okay, why? Because you got to know what you're working on. Okay, do you take post x-rays to document the structural and neurologic changes? No, I only take x-rays because that's what the insurance company tells me I can take. Okay, yeah, it's a bureaucracy. It's insane. Okay, do you mark the x-rays? Because some people will take them just to bill for them. But if you're marking the x-rays, you're actually having an objective analysis on those films that you're going to mark again. So this way you know the exact percentage that's wrong and the exact percentage you're going to correct them. Can you reverse arthritis? If you understand that arthritis is an adaptive change from trauma and you're going to fix the trauma, you better be able to document that you're going to fix it. You work on post-surgery cases. I've had a lot of patients or a lot of chiropractors that I've met that say, well, I just wouldn't touch that. Okay, yeah, with an 80% failure rate, 75 to 80% failure rate, you have to. If you're given a position of authority that people are putting their health in your hands, you have to do everything you can. If you don't know what's wrong or how to fix it, by God, learn. I would take or give a seminar a month before the mass insanity. I still do with weekly talks. Okay, do you work on the elderly? And I'm talking somebody that's extremely osteoporotic, taking 32 different prescriptions, has the worst I've ever seen is 12 fractures of the spine. 12. Okay? And did we still work on her? Absolutely. Because if you get a compression fracture that's non-pathologic means the back half where the nerve is coming out, that one's still integral. It's got good integrity, but it comes to a wedge shape. So what do? The first thing you do is distract that joint. Lay them down and distract it out. And I'm going to tell you, if you're a chiropractor that's not familiar with that, call me up. I'll walk you through it. But you're going to have the patient just go, ah. And bones can remodel. It's brilliant. And do you work on kids? You got to do this. Because if not, I've got a number of chiropractor friends that, I work on, before when they were in school. I want to be an athletic chiropractor. Okay, good. Are you going to let their kids just rot in hell? Are you going to refer them out to somebody that doesn't do that sports? Okay, because when parents would say, when should I bring my kids in? Well, you can wait till they get sick as hell, Bob, or you can bring them right in. It's just common sense. Bonus question, this is the stuff we do: nerve scans, thermography, dark field analysis. So you're looking at the chemical stressors. But to do this, get as much objective analysis as you can. The reason is only 10% of the nerves carry pain fibers. You can't go on how do you feel. Okay, you got to see what you look like. You've got to get sleep. This is huge. If you want to regenerate your disc, you want to correct stenosis, sleep is when the body regenerates. So you got to change those circadian rhythms. Look at all of our sleep videos. Meditation, prayer. This puts you in that parasympathetic state, plus identifying with a power that's greater than you. If you're able to work with that power, it's even cooler. Okay, that's called like prayer. It's really neat. It works good. Okay, or you can meditate. Yeah, but we are more energy than matter. So when I put this stuff up, proper nerve supply, exercise, nerve supply, you live your life through it. Regular exercise, you got to move every joint every day. Proper nutrition, if man makes it, you don't eat it. Okay, because your body's designed to metabolize stuff. So when people say, well, what's the best diet to reverse stenosis? Okay, you're going to eat like your great grandpa ate. I know he was obsessive. He only ate organic, he only ate free range, and he only ate, seasonal. I know. That's all that was there. Okay, sufficient rest. That's when your body regenerates. Poor sleep pattern means poor regeneration and prayer and meditation. It seems too simple, but it is possible. But the only way to tell is through an accurate assessment. Now, we're going to start getting into the scary stuff. I say scary because it's a censored time. Okay, and this is tough. Okay, so good. I'll see you later next week on Facebook. I'll see you later next week on YouTube.